Okay, that's great. We've got a number of questions that come in, so thanks so much for that, Howard. The first question is from Georgia Salanti. It is the contrast-based network meta-analysis is preferable to ARM-based for the standard network meta-analysis. However, when it comes to incorporation of single-arm studies, ARM-based NMA naturally incorporates them, and given that your method that uses the contrast-based NMA makes assumptions, it loses its clear advantage over the ARM-based method. Can you comment on this and whether the ARM-based model should be considered?
Well, an ARM-based method would effectively break randomization within the connected component. So we've sort of gone out of our way to do is to preserve the advantages of contrast-based NMA in the connected network by preventing any sort of interference with randomization. So I do agree that ARM-based method would naturally incorporate these single-arm studies, and it is something you could do, but we'd be raising this question about interference with randomization in the connected network, which was one of our motivations to avoid.
Great. So the next question, how do you advise people to communicate the limitations of NMA estimates based on disconnected networks to decision makers who already struggle to understand NMAs? Should that advice apply to all estimates for all pairs of treatments that are disconnected?
Yeah, so there's a natural benefit to these methods that we have a much wider credible interval for the disconnected networks. So we'll be able to say quantifiably, this is much more uncertain. And I would strongly encourage to present the connected results and the disconnected results separately rather than the same table or the same rankogram or the same forest plot. So you need to keep the two separate. You need to show the wider uncertainty in the disconnected portion and make sure you get across the problems of assuming that prognostic factors are similar in the connected component to the disconnected component and saying, well, we've only got 5 trials to predict this reference treatment, so we don't really have much evidence to fit these models. So I think it's all about just being very open about all the limitations of the methods and keeping the 2 sets of treatments separate.
Yeah, that's great. Okay, so our next question is, what would you take as the baseline response in the case of time to event outcome with the hazard ratio as the effect measure?
I'm unsure if I understand the question. Is it what model would we assume for the baseline hazard?
Yes, what would you take as the baseline response in the case of time to event outcome?
We take the absolute hazard of an event on each of the arms. Like if we were looking at the time to progression on some treatment, we would have a Kaplan-Meier curve for them, and then we would fit a model to the log hazard on that, so like a Bible model or exponential survival model. So I don't see a huge difference between the 2 methods.
Right. The next question is. So Goethe, that question was from Goethe. Goethe, if that doesn't answer your question, please clarify. So our next question is, given the impact that gamma has on both the bias and coverage, are there any empirical studies regarding the potential values for this parameter in NMA?
There isn't, but I mean, just because I haven't run them and I don't think anyone has really looked at it formally, but I'm sure you could look at, say, a collection of Cochrane network meta-analyses, artificially disconnect the networks, and then measure the difference in the covariate effects between the 2 components of the network, and that would give you some sort of quantification of the gamma. That's a whole extra study I haven't run, but I think that's how you would go about it.
Great, thank you. The question about references. So the presentation and the will be put up on the Cochrane training website. So you'll be able to obtain
sorry, references. I can scroll back if anyone wants to make sure.
Yeah. Okay, so the next question is, what about component network meta-analysis, which was a recent webinar that we had delivered by Nikki Welton and Debbie Caldwell. This would also have worked in your very first example.
Yes, it would. So components network is actually, it's another way to overcome disconnected networks, because you, instead of having a network of lots of very different treatments, you have a smaller network where we're regressing on different components. So you kind of use that to overcome disconnected networks. But if you did have a disconnected network, even with the components NMA, it wouldn't be a huge leap to include reference prediction or accurate level matching inside of those analyses.
Great. And coming back to the question before about the hazard ratios, so Gert has just made another comment. He says that the problem with the Cox model is that you don't estimate the baseline hazard explicitly, you only have relative effects.
Yeah, so that's why I was talking about estimating the absolute hazard. So you'd fit a viable survival model to just the survival curve for the reference, and then you meta-analyze across them. I'm saying viable, but you could use fractional polynomials or whatever you want.
Right.
And then you put the hazard ratios on top of that. We're currently doing an analysis like that in knee replacement surgery.
Okay, and the final question that we have here is the baseline response effect, actually the response effect measured on the treatment you choose as your reference, correct?
Correct. The baseline, so in the atrial fibrillation example, we were trying to predict how warfarin would do in the disconnected networks. And obviously it depends on which treatment you choose as your reference, but these models are invariant to your choice. So I would recommend choosing the one on which you have the best data or the best clinical understanding to build a reference prediction model.
Okay, well that's all the questions that we have, Howard, and we're far off the hour. So I think we'll wrap it up here, and I'd like to thank you once again for preparing the presentation, a really interesting presentation.